What is anxiety disorders? Everyone can feel anxious, and it is normal to have anxiety. People may feel anxious or nervous due to certain situations, such as go to an interview, stress due to work overload, having a problem at a workplace, take a test, or make an important decision. However, anxiety disorder is the excessive fear or worry about a specific situation. According to a study, there are estimated 301 million people worldwide who have anxiety disorders. Women are more likely to be affected by anxiety disorder than men due to biological differences and hormones as the main reason. In this modern era, teens and young adults at the age of 20 to 34 are often suffering from anxiety disorder. There are 6 main types of anxiety disorders. Each type of anxiety disorder can have a significant impact on an individual's daily functioning and quality of life. Have you ever heard of generalized anxiety disorder or GAD? GAD is different from the normal anxiety, as it is characterized by excessive, uncontrollable worry about activities, events, or everyday situations. Individual suffers with GAD often overly concerned about minor issues that is difficult to control and can affect daily activities. Next, panic disorder is a type of anxiety disorder which the individual will feel sudden, intense fear that leads to panic attack. These attacks are sudden episodes of intense fear or discomfort that reach its peak within minutes. Social anxiety disorder is characterized by an intense and persistent fear of social situations due to fear of being judged, feelings of embarrassment, or humiliated by others. Individuals are often try to avoid places and social gatherings where they experience social anxiety. Agoraphobia and social anxiety disorder are closely related, but both are different in the causes of the symptoms. Agoraphobia is the fear that arises when a person is in a crowded or public area, where it may be difficult to escape and help is not readily available. Specific phobia is an extreme and irrational fear of something that causes less or not any actual danger. For instance, specific phobias include the fear of heights, airplanes, insects, enclosed spaces, or thunderstorms. Lastly, separation anxiety disorder is one of the most common childhood anxiety disorders, which the person has an excessive amount of fear and fear of the actual and anticipated separation with parents or others who have parental roles. The condition occurs at an inappropriate age or inappropriate context. Experts are not sure of the exact cause of anxiety, but there are several factors that can contribute to anxiety disorder. Anxiety disorder can occur due to genetics, neurological function, disruption, stress, childhood abuse, environmental factors, natural disasters, and traumatic experience. People who suffer with anxiety disorders usually can experience some common symptoms. The symptoms may include feeling irritable, nausea, abdominal distress, heart palpitations, sweating, trembling, insomnia, and having a sense of impending danger, panic, or death. Treatment is necessary when a patient exhibits noticeable suffering or experiences complications as a result of the disorder. The patient can go for psychotherapy, which is also known as a talk therapy or counseling. This involves the patient to communicate with a qualified therapist who can help them understand certain feelings and behaviors. A person with mild and shorter term of anxiety disorder can also do self-treatment without clinical supervision. They can do physical exercise while learning about stress management, relaxation techniques, and many more. People with anxiety disorder are also encouraged to maintain their social network. Anxiety disorder can be treated through medications such as antidepressants, benzodiazepines, and tricyclic antidepressants that are prescribed by doctors. Various studies have looked into specific effects on individuals that relates to the ongoing digitalization. Some researchers reveal that digitalization can lead to both positive and negative effects to individuals. The positive impact of digital technology is the access of information. Individuals who suffer with anxiety disorder can access unlimited amount of information through the internet to learn more about their condition. They can also find ways to manage the symptoms of anxiety disorder. Besides, social media platforms can provide social support to people with anxiety disorder. They can connect with others who have similar experience and share their thoughts and receive opinions. Digital technology also benefits the patient through online therapy. People who are unable to attend or uncomfortable with a face-to-face therapy can connect with a licensed therapist from the comfort of their own homes. However, people who spend most of their time with mobile devices tend to feel socially isolated as they rarely interact physically with other people. Social media platforms that allow open commenting can quickly turn into extremely fearful environment for cyberbullying victims. Some people will throw demotivating or offensive comments. To conclude, the advancements in the treatment of anxiety disorders will continue to bring hope and relief to the people and families affected by these disorders. Thus, It is also important to consider the patient's feelings about their mental illness and address their responses early in treatment.